Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 25th of June 2022 OET exam, in which as usual I'm going to discuss with you all about OET writing and OET speaking. Okay, so let's move on to the topic. So what is the letter and what is the case note and what type of letter they have asked. As usual, it's a known case letter. Last time we had a letter of discharge from the hospital to discharge to nursing home, and this time a patient is already in a community under community care service, and patient got some issues, so patient gone to the emergency department and patient is referred back to the same community center. So it is a known case letter. So let's move on to the case note. What exactly the story about patient? Okay. So actually, patient name is Dorothy Landcraft, and she is an 81 years old. She was a resident of community health center and has been transferred to a new community health center 1 week back. So on the day of when she got admitted on the hospital, which means 7th of Jan, and we know that since the January onwards we are receiving all the letters, the date of admission or date of discharge is everything is January. So we have to be very careful in that, because the date of admission, date of discharge is which is the date they are given, that is the date, and also today's date in the letter case note, today's date like that, which day they have given, that is the date we have to write it in our letter. We have to make sure with that, because since January onwards, what are the letters we are getting it all in most of the letters they have mentioned the date as a January date only. Okay. So why she got admitted to the emergency department, which means because of a fall. And that fall happened because of the syncope and lightheadedness. And also she had a nausea 2 days prior to her hospital admission. And in the hospital they have diagnosed to have syncope due to hypotension, postural hypotension kind of thing. And she is a widow and 2 daughters are living. She has 2 daughters. And she was transferred. Actually, she was transferred from one community center to another community center a week ago. And also she is an alcoholic. She drinks almost 3 to 4 standards of glass in a day. She is a non-smoker. And regarding her past medical history, she has colon cancer. It's a grade 2, and resection of the ball done. And also she is osteoarthritis, dementia and depression. In the hospital, what they have done, once she got admitted because of the fall, and that fall happened due to syncope and lightheadedness. So they have diagnosed to her as postural hypotension. So for that, what treatment they have done, which means, and what diagnostic procedures they have done. They have done blood test and ECG, and they have done an examinations. In that they came to know that she got urticaria on shoulder and cholinergic urticaria also, and also they have prescribed medications for that, because her sitting BP was okay and the lying down BP was slightly high than the normal. So these all are the diagnostic procedures and assessments and blood investigations have been done during the hospital stay. And the patient is getting discharged today, which means on 8th of January. Patient got admitted on 7th of January and getting discharged on 8th of January. So what are the discharge advice they have given for the patient, which means it is daily monitoring of fluid balance, avoid caffeine contained products, encourage more fluid intake and small frequent diet. And also they have explained avoid orthostatic hypotension. So they have to assist her while she is going to the bed, while she is sitting, while she is lying down. They have to carefully monitor her condition. And also they have advised to continue the tablet, Losatin and other all relevant medications. So today is the 8th of Jan. She is getting discharged, and she's back to the same community health center. So we are writing a letter to the senior nurse of the community health center outlining the relevant medical history for the future ongoing care. So here we are writing to the senior nurse of the community health center. So now it is a known case letter. Patient is refer back to the same community health center because patient is a resident of community health center. Okay. So here we are writing the letter to who? A senior nurse of the community health center. So we are going to address this letter to the nurse. It's a known case letter. When known case letter itself, we have to omit two main things, which is social background and past medical history, because they knows already what she is taking and what is her condition, how about her social status and what is her social background, everything they knows about it. So only the thing we have to look for present medical history and discharge advice. These are the main important notes that we need to look in the case notes, and we have to write a letter to the community nurse. Okay, so how we can write a letter now? As usual, we can write an address first, or else date first, or else address second, date second. So choice is yours. We can write it as per any of the way, but the both way is right. So to whom we are addressing the letter? The senior community health center nurse. And the community health center, and what is the remaining address they have given in the letter as per the things where we are writing it. While we are writing an address, the main thing is if they have given the name of the community nurse, we can just write a name. If they don't have given the name, so please always write the address start with the D. And first letter of the each word should be a capital letter. Should not use any punctuations like comma, quotation, apostrophe, should not use in the address. Should be a plain address. And now coming to the point of date and which day we are writing the letter, that is the date we have to write it on the top of the paper next to the address. Then salutation, as usual, dear nurse. And coming to the point of reference, you are writing a patient name, full name, as she is a widow, so it's a Miss what they have given, either is Miss or Mrs. what they have given in your case note. So write it the same, and the age is 81 years old. So now introduction. So to make an introduction, as usual, we need 3 points: patient present condition, patient full name, and a purpose. So here the purpose is we are referring back the patient to the same community nurse for the ongoing care and further management, isn't it? So how we can make an introduction? So we can write, I'm writing to update the current condition of. This is the one way of writing, and this is like another way of writing an introduction, which means we can write is this letter is written to update the current condition of. There are n number of way we can write it. Condition of Mrs. Dorothy, and what is her full name? It's Dorothy Longcroft. So you can write, I'm writing to update the current condition of Mrs. Dorothy Longcroft. Dorothy Longcroft, and we are just writing who is diagnosed with orthostatic hypotension. So full stop. She requires ongoing care and further management at your service following her discharge today. So this is the one way of writing an introduction. Or else if you don't want to write, I'm writing to update, this is not all, I don't want to make a simple introduction, which means Mrs. Dorothy Longcroft, who is recovering from or who is diagnosed with orthostatic hypotension, full stop. She requires your ongoing care and further management, full stop. So this is another way of writing an introduction. Okay, so choice is yours. Either you can go ahead with I'm writing to update the current health condition of, or else you can write this is like how to say this letter is written to update the current health status of. So choice is ours. N number of way we can write, but we need mainly 3 things to make an introduction. One is patient full name and patient current condition and what is the purpose. That's it. Now coming to the point of body paragraph. So here we have to write elaborately, because they does not know after the admission what happened and what on the treatment we have given to the patient, how the patient reacted to the treatment, and what is the patient prognosis at the time of discharge. So they does not know about it. So we have to write that one elaborately. So we are just starting with a paragraph with the second name of the patient. So what is the patient's second name? It's a Longcroft. So Miss Longcroft was admitted on the date of admission you are writing following a fall due to syncope and lightheadedness. what they have done. So immediately in the emergency department, they have done an assessment. So on assessment, what are the signs and symptoms they have found out? So on assessment, she was found to have blood pressure of this much while sitting and while standing, and also so on the assessment they have found out the blood pressure. So what was her blood pressure? As I said, her blood pressure was like, while sitting it was 124/70, and while she was lying down it was 134/70. So when she came to the emergency department with a complaint of fall that happened due to syncope and lightheadedness, immediately we are doing an assessment. So on assessment, she was found to have a blood pressure of 124/70 in the bracket while sitting, and also 134/70 in the bracket lying down. So what else we have done? After that, she has taken for the blood investigation, and also she was noted to have erythema, rashes on her brow line and also on her shoulder and leg because of the fall. So the erythema was on her brow line and shoulder and leg. So in the assessment we came to know her BP sitting and lying down, and also we came to know that she has the skin rashes, like kind of erythema rashes on her brow line and shoulder and her leg area. So also what else we have done? So she has taken for a blood investigation, an ECG, and also she was done with a examinations. A common examinations has been done for her. So Miss Loncrit was admitted on the date of admission following a fall due to syncope and lightheadedness. Full stop. On assessment, her sitting BP was 124/70 and lying down BP was 134/70. Full stop. In addition, she was noticed to have erythema, rash on her shoulder, brow line and leg. That's it. Assessment done. After the assessment, what else happened? She was taken for blood test and an ECG. And also she was diagnosed with the above mentioned condition, because the condition name we have already written it our introduction. So it is not necessary for us to write it in the body paragraph again. So for that, what treatment they have given? Therefore, she has commenced on Losatin 10 mg daily. As she responded well to the treatment, she is being discharged on the date of discharge, you are writing it. So finish. So only less information is there to write your body paragraph. Now next, coming to the point of your discharge advice is very important. So when you are writing a discharge advice, we have to write it like in a requesting way. So what are the discharge advice we have just said? Regarding the discharge advice, we have to write, start with upon discharge, or you can write with upon discharge, or in view of the above. You can write it like that also. As per her discharge advice, like that also we can start. So choice is ours and we can just start. It would be greatly appreciated if you could monitor her health condition. Full stop. Then it is important to support her. What is for the supporting? Because they have advised to changing the position while she is getting up from the bed, or while she is standing, as well as while she is getting into the bed. So they have to assist her, because as she is diagnosed with a postural hypotension, at any time she may fall. So we have to assist her. So that's why we are writing it is important, and standing as well as getting in bed. This time we have to advise, support her, and kindly encourage her to drink plenty of water. However, she has to avoid coffee at night. Mainly they are given the discharge advice, this is. And monitor her food intake, and a daily weight chart is very important also. And it would be highly appreciated if you could arrange a psychiatrist and an occupational therapist in case of necessary. When she needed, it will be highly beneficial to arrange a psychiatrist as well as an occupational therapist, because in the discharge advice they have given a question mark before the psychiatric service as well as the occupational service, which means whenever she needed, it is the good thing to arrange it for her, these services. That is the thing they are mainly to say. So it's a very simple, it's a known case letter, and nothing to write more. Though she has a more past medical history and medication history, it is not necessary to write it because we are writing to a same caregiver, and it is not necessary also to write all those things. Only from the date of admission to date of discharge, what happened, how the patient reacted to our treatment, what treatment we have given to the patient. And in the discharge advice, we are just writing it everything in a very recommending way or requesting way. It would be greatly appreciated if you could. Most importantly, it is worthy to note that please ensure that kindly make sure that, most importantly, so these all are the things that we are just writing it in a very requesting and recommending way. So the letter is so easy, and I hope you all have done in a very good way and hope for the best result. And next thing is speaking. Speaking was so easy. It is a common, quiet and recurrently asking topics only. One is like asthma, explaining about the importance of inhalers, technique and inhaler to the 8-year-old boy, to the mother. And second is colonoscopy, preparing the patient for the colonoscopy. And the third topic was like conjunctivitis. So we are just explaining how to clean the eyes and how to put the drops and what are the precautionary options that we need to follow it. And another topic was acute appendicitis. So another thing was like they have asked oral thrush. So it's a very common topic which is also a familiar topic to us already, like whomever is going for the classes and preparing themselves, these all are the topics you have come across already. These all are topics they have asked also. We have prepared many times. So it was a quite easy exam only, I could say, because my students also were saying the same thing, and they said that listening reading was quite bit difficult, but they have tackled it in a good way. Anyhow, we'll see and hope for the best result. And I hope this video will helpful for everyone who is preparing for their exam and who have done with their exam. They might be getting an idea like overall the letter will be like this. So main thing is we have to omit the social background and past medical history of the medication history of the patient, because which is not necessary in the known case letter. Okay, so whomever wants to join in our class, we have mock batch, and we have 40 days, 60 days, 50 days, 30 days classes, and also whomever wants to only concentrate on your reading, listening and writing and speaking. So we have individual modules also. Our number has given in our description. Whomever wants to join in our class, you can contact us at any time and you can join in our class. So until then,